Nice. Hi. Hello. You can hear me. Good. All right. Today we are going to move on to the next portion of the skeletal system. Last time we talked about the bones of the axial skeleton, and today we are going to talk about the major bone of the appendicular skeleton. Okay. So let me share my screen. Share. All right. Major bone right here. All right. So here is the skeleton again. Last time we talked about the axial skeleton, uh, the skull, vertebral column, uh, and then cage rib. So that's pretty simple. Um, and then today we are going to talk about the appendicular, those attached to these axial portion. So like arms, and the legs, basically just arm and legs. So still very easy. Um, so let's take a look. So basically here summarize everything about the appendicular skeleton. Don't worry about the number. I'm not going to quiz you how many bones do we have in the body. Well, there are some variations. Uh, so so because besides that's not the major thing to it's good to know, but it's not that important. What's important is to be able to identify the name of the bone and their connection of each other. How do they connect with each other? When they connect each other, basically they form a joint. That's how we perform the movement. Yeah. So basically we have the clavicle right here, scapula in the back right here, scapula. Uh, we have one on each side, so it says two. Then here is the arm. It's called humerus. And then here is a forearm. Forearm, we have the bigger bone. This is called ulnar. A smaller bone, this is called radius. Radius, even though it's smaller, but its uh, distal end uh, is much larger than the ulnar, so the distal end form the wrist joint uh, with the arm, sorry, with the hand. And the hand bone, basically we have a lot of carpal bones, metacarpals, and then the fingers are phalanges. So that's that. And then our hip bone, right here, hip bones. We have one side, left side, so we have two. And then here is the leg. That is the femur, very large, very strong. And then down here is our knees. Our knee on top of the femur distal end, we have the patella. And so it's not, it's a bone, it's a separate from the femur. And it's right there. It's our knee bone. And then here we have the tibia. Tibia is also much bigger than the other one that's called fibula. And you can probably touch it. You know, if you touch your leg, uh, you will feel that. You can directly feel the tibia and the fibula. And then these tibia form the knee joint with the patella and the femur. On the other end, tibia form the ankle joint with our foot. Our foot bone has the tarsal bone, metatarsal, and the phalange. So phalange is basically any finger here, phalange is here, phalange is here. So any finger bones are phalanges, whether that's hand or foot. So that's it. You know, very simple. You got everything already. And then, so I think that's it. So we will just look at each one of these, and yeah, and so pretty easy. Should be very easy. So here, the first one in the top here, the clavicle. So let's see where does it attach to. So clavicle is a long bone. One side attached to the sternum, and the other side attached to the scapula. So it has two joints. It forms two joints. Clavicle joint, scapula, and sternum. So right here, sternum, this sternum, and here's scapula. In this sternum part, it forms a joint. This joint is called sternoclavicular joint. In the scapula, it um, join scapula at the sorry at the acrom sorry acromion process. We will learn about the scapula right here. So this scapula, if you look at the front anterior view, this is although in the back, if you look at the front, you see it's flat. So that's how you see in the front. And here is where you see uh, sh the shoulder joint right here with the arm. And here we have two processes. The front one is called coracoid process, and the end one or the back one is called acromion process. And the clavicle is joined articulate with the acromion process of the scapula. So that's that right here. If you look at the back, you see there is a spine of the back of our scapula. And in the end here is the acromion process and the clavicle attached to that. So that's right here, attached to that acromion process. And this joint is called acromioclavicular joint. So that's that. So here showing you that we can change our like shoulder blade, our scapula, and then lift our shoulder, right? Lift up our shoulder without changing our uh rib cage, because we can pull it up, pull it up. We have muscle to pull it up, pull it up, and so that this joint allow us to do that movement. So and then in the back we have this scapula. Scapula joint has two joints. One part joined with the clavicle by acromioclavicular joints right here, and acromioclavicular joints to join with the clavicle, and the other one here, this one will join with the arm bone, the humerus. So let's look at the structure. Structure very simple. If you look at the anterior view, you can see it's flat, and now you have it's a triangular shape. So triangular shape, you have three border. You have the superior, lateral, medial. So basically, if you put it in the back, you see that right here. So this side is the medial, this side is the lateral, superior. So middle is close to the middle of the body, and so that's this one here. How do you know which one is which? Because you see this place, right? This place is where your arm attached to it, and this place is right here. So that's the lateral. The place where arm will attach to it is called glenoid cavity. So here is a glenoid cavity. Our femur humerus will uh will connect to our scapula by attaching to this part. Yeah, so that's that. Um, and that's probably everything. Oh, yes. So yeah, so This one is called, this small fossa here is called, fossa means like, it could be like the bottom of like depression, but it's not very deep. It not go through, it's just a little bit flat. So this one is not very deep. This one is very flat. This fossa, it's called subscapular fossa, scapula, but a little bit lower, subscapular fossa. And then yeah, so this glenoid, there are some like a smaller structure called rim. Rim means like a surrounding ring of the glenoid cavity. So that's all right. Lateral angles. Um, when we look at the Yeah, so when you look at this side, you saw the glenoid. The lateral view, you saw the glenoid cavity. Uh, and then if you look at the back, from the back, you can see here you have the spine. So that's more important right here. Is the spine. Spine can separate it superior spine, inferior spine. So you can hear superior spinous fossa, and here is the inferior spinous fossa. Yeah, so that's that. Okay, you need to know that what does it, attach to? Where does it, which bone does it connect with? It connect with the uh, humerus and the clavicle. For with the humerus, the glenoid cavity attached to the humerus head, and then that forms the glenohumerus joint. It's also called the shoulder joint. As for the clavicle we talked about that already. It's the acromioclavicular joint. And then you have the arms. This is the single bone, humerus. And so this is the humerus head. Humerus head, you see this uh, you see this cartilage. It's very smooth. And so this one allow the bone to, create the very flexible movement while still attaching to another bone, which is the glenoid cavity of the shoulder. So humerus has some features. This one is called the laser tubercle. Tubercle means like a rough area or like protrude, but not in area, but pretty rough. Basically, muscle tendons can attach to it. This one is the laser one. This is greater one. This is the between. Uh, in our lab, we would read this one. It's called intertubercle feature. Uh, and then going down here, you have something pretty rough here. Uh, it has a triangular shape. It's called deltoid tuberosity. And then continue radial groove right here. In the This is head, this is neck, um, surgical neck. Basically, this part is the part that doctor commonly see when there is an unbroken broke at this region. If we cut through, we see that this is compact bone. Inside is empty, so this one is the bone marrow location. Yeah, all right. And then keeping looking down here, the distal portion, we have the cartilage again. It has two surface. One is called capitulum. The other one is trochlea. And this one will basically connect with the forearms. Forearm, we have the ulnar and the radius. And so they will attach to here, ulnar and the radius. Yeah. And so when the arm move, they can move forward, right? Flexion. And so when they move, it will stop at this root. Basically, you can bend all the way down. So this one doesn't really stop anything, just provides some room for arms to locate, bone to locate. This region is called radial fossa, so kind of give you the idea that this part is a radius attached to it. When they bend, they hit on it. This one is called the coronoid fossa that hit on the coronoid process of the ulnar. And here you have the lateral epicondyle, medial epicondyle. How do you know which one is which? Basically, you look at the head. Head attached to the medial, so this one is medial, and so the other side is the lateral epicondyle. So that's that. When we look at from the posterior view, you can see the greater truncator, sorry, greater tubercle is much more noticeable. The head, surgical neck, again, the shaft. So uh, between two ends, the major portion right here is called the shaft, the body. You can also see here is a radial groove for the radial nerve to go through, and then deltoid tuberosity, our muscle attached to the deltoid, our uh, biceps muscle attached to the deltoid uh, tuberosity. And then down here in the posterior view, you see this fossil here. This one is a trochlea. So when the bone move out, extension, it cannot move further because it can stop here. This one is called olecranian fossa. Yeah, so that one will host the olecranian or olecranon process of the ulnar. So that's that. So humerus, this one just summarize their key features. And so the femur head attached to the granule cavity of the scapula to form the shoulder joint. So we know that already. And between the humor and the forearm, we have this elbow joint. Let me show you here. So here is maybe here. Here is the elbow joint. Elbow joint involve three bones. One is the humerus, the other one is ulnar, and the other one is radius. The primary one is the humerus and the ulnar. And because here is a trochlea, and so trochlea allow the ulnar to slide back and forth without the problem. But when they slide backward, like extension, so you can slide back and forth, no, it's not problem, but extension, this extension can get stopped by like 180 degree by this process, this olecranon process of the ulnar. Olecranon process will sit into the olecranon fossa of the humerus. So that's that. So trochlea with this uh, trochlea surface of the ulnar, radial radius head will attach to the uh, uh, capitellum of the humerus. Let's go back to here. So elbow bone capitulum of the humerus are articulate with the head of the radius. Trochlea articulates with the trochlear notch of the ulnar. Olecranon fossa articulate with the olecranon process of the ulna. And so that basically is where, bone join each other to allow the movement. We also have two other key features for the several other, but for the elbow portion, we have this uh, medial and lateral epicondyles. And so medial is close to the body middle, lateral is close to body lateral side, and this allow muscle and tendon to attach to it. So basically, you need to know, able to identify it, and also know where or how they uh, attach or contact with the other bone. Because joint is important, bone by itself doesn't really do much. It provides a structure, but you need to have joints so you can have the movement. Because bone by itself is you cannot bend it. So yeah. All right. So I think so that's humor, and then down here is a forearm. Forearm we have two bones. One bone is pretty large in the elbow joint. The other bone is pretty large in the wrist joint. So even though both are involved in both joints, but the one bone is more important in one joint, and the other bone is more important in the other joint. So here we have the ulnar, we have the radius. Ulna is more important for the elbow because olecranon will, here you have the trochlea notch. Trochlea notch will sliding with the trochlea of the humerus, but the olecranon process will prevent our forearm to extend further more than 180 degree. Yeah. And here you have this radial ulnar joint, proximal radial ulnar joint. This is distal right here. Where is it? Anyway, here, distal radial ulnar joint. So ulnar and the radius are attached to it in two ends. So there is proximal one and the distal one. Between these two bones, there is a connective tissue called interosseous membrane to keep these two bones, kind of like hold them together. So that's that. I think that's everything. The bone between two ends, for any long bone, we have shaft. So that it doesn't mention here, but it's a shaft. And then in here we have the uh, this is the distal portion of the uh, of the uh, of the uh, of the ulnar, and here each one of these has a ulnar stylus process. This is called the head of the ulnar. Here is the articulate cartilage. So this cartilage just provides some smooth surface for bone and bone contact. You can see a little bit cartilage again here, carpal articulate cartilage. So this is the radius. Yeah. So that's that. And then after talking about this forearm, the next thing is the wrist. So just a little bit summary about the ulnar. So ulnar in the um, proximal means like our body, and the distal is away. The proximal portion, the key feature here is that it has this uh, olecranon, and so that basically anchor on the end of the back of our humerus, and so to prevent our bone to moving further away, further to it. Yeah. So here is the orecranon. This one is the trochlea notch. Here is we have the cartilage to make this space very smooth. Here is the radius notch. This one attached to the radius, the other bone. So that's that. This process is called the coronoid process. Yeah. So trochlea notch join trochlea notch right here. Trochlea notch join humerus trochlea. Um, the coronoid process join the humerus coronoid fossa. So by the name, you kind of know where does it go to. Radial notch right here. Radial notch join the radius, the proximal radius joint, form the proximal radius radio-ulnar joint. The orecranon process join the humerus orecranon fossa. This also you can feel it in your elbow. Yeah. So here is the view of the elbow bone, elbow joint, anterior view and the posterior view. You can see that here is the trochlea notch. Inside here, trochlea notch that slides in the trochlea. You can your forearm can move all the way down with no stop. You can move it all the way down with no stop. The only stop is the bone itself. But in the back, you cannot move further more because it got stopped here in the orecranon and orecranon fossa. So that's the key part of the elbow that femur and the ulnar control their the range of their movement. Here is the radius head attached to the capitellum right here. Still very smooth surface. Yeah. So I think that's the major thing here. This part is the coronoid process. The back is the orecranon process. The coronoid process will sit into the coronoid fossa when we completely uh, flex our arm to our forearm to our arm. Radius head joins the humerus capitulum to form the elbow to be part of the elbow. Is a disc-shaped structure. This head, this head is not like round like humerus. This head is flat. And there's a neck, there's a shaft. The shaft is slightly curved. So I can show you here. This one is slightly curved. And so in the between, we have the interosseous membrane right here. Interosseous border of the form the interosseous border of the radius. The ulnar notch join the ulnar head and to form the distal radial ulnar joint. And there is a stylus process. Both ulnar and the radius has the stylus process. Let me show you here. Both ulnar, right here, stylus process, radius, right here, radius, stylus process. So stylus process is where we have this process to control the wrist movement. Stylus process. The distal end of the radius. So ulnar is more important for the elbow. The wrist is mainly controlled by the radial distal end. Yeah. So the radius distal end of the radial. Yeah, radial. of radius join two carpal bone. Carpal bone is the hand bone, carpals, and two of them join with the radius, and that form the radial carpal joint here, radial carpal joints, and that is a primary portion of our wrist joint. So if you look at the bone of your hand, the bone that has most of the contact with the carpal are called, this bone is the radius, not the ulnar. Ulnar almost do not touch the carpals. Yeah, but radius um, touch the carpal directly. So here is a picture showing you that. So wrist and hand. And so here is our hand. This radius. So you can see that in our elbow, it's ulnar plays the major role. But in our wrist, it's radius plays the major role. Radius attached to two of these bones, two of these carpal bones. So here give you a name of the carpal bones. Two of these bones are scaphoid and lunate. They directly contact with the radius. Here's the ulnar, and this bones. I think we have 8 bone here. 1, 2, 3, 4, 5, 6, 7, 8. So 8 bones are called the carpals. Carpals. And then here is called metacarpal. So after that, here is the metacarpal. It's basically from our palm. And then here is our finger. Our thumb only has two segments, but the other finger has 3 segments. All these bone, our finger bone, is called phalange. And the phalange, you can call phalange 1, 2, 3, 4, 5 from the thumb into the pinky finger, or you can just call them phalange. When you have 3 segments, this is called distal segment, distal phalange, middle phalange, and the proximal phalange. So that's the wrist and the hand. This one show you the wrist joint, the radius will mainly the primary one to control our wrist movement. It attached to two carpal bones, scaphoid and lunate. And here is the ulnar. You can see the ulnar become much smaller in the distal end. And here it generates this articulate disc. So it provides some more like smooth area for wrist movement. So wrist joint is also called radial carpal joint. So by the name, you know that it's a radius and the carpals to create this wrist joint. I just so that's the hand. The upper limbs. Oh, another portion important is called our hand. You can see the hand here. This is the anterior view, but don't get to appreciate that our hand is actually curved, right? Our hand is curved here. And so this one, basically a lot of nerve sorry, it's blurry. Nerve, muscles, tendons will go through so you can pull our finger and provide the blood supply. So things go through, but this one is very limited space. And so the way we do it is that we create, make it a curve, make it a curve. And so right here, so that is the curve right here. So this is your palm, this is a curve. And so that curve create this room, this tunnel. Because the bone here is called carpals, so this tunnel is called carpal tunnel. This carpal tunnel allow a lot of these tendons to go through, the muscle tendons. And also nerves right here. and also blood go through. So if there is any uh, infection, inflammation, then that cause pain. So that's carpal tunnel syndrome. Yeah. So good rest of your wrist if you do too much of the computer work is important. Also, make sure you have a good position when you do those computer work or yeah. So and this one thing important to know here is that the tendon to create that tunnel, you have to hold this bone like tightly together to create this tunnel. Tendon right here is called a flexor retinaculum. Flexor retinaculum. Yeah, so that's the tendon. Yeah, so that's the key thing here. Carpal tunnels right here, muscle tendons, multiple here, nerve here, carpal bones. And so this one showing you four of them. We totally have 8 bones. Yeah, so you can see hamate, this one here, hamate right here. This one is capitate, trapezoid, trapezium. Yeah, so that's that. So that's the upper limb, and then here is the lower limb. So appendicular skeleton basically is upper limb and the lower limb. In the lower limb, here is the lower limb. Everything about the lower limb is start by the pelvic girdle. You have hip bone, and then hip bone provide the space or provide the base for hip joint. Hip joint is the joint for your leg to move. So here is this bone is the femur, and then your leg, your knee has this bone called patella, and then the lower portion of your leg is tibia. That's a bone, you can feel it. The largest bone, not much larger than the fibula. Fibula is very much just a supporter. And then here is the foot. Foot, you have tarsals, metatarsals, and the phalange. Yeah, so that's that. So let's look at this hip bone first. So this one is a hip bone. Hip bone, we have 2 hip bones. So this is a lateral view. So it's showing you 2 things. One is that it's a merge of the 3 bone, even though there is no clear suture in a way, or the border in a way, but it's known that these are formed by 3 bones. So you need to know the name of these 3 bones. This one is ilium. It's this I. It's not LL. It's I. LIUM. So ilium, ischium, 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 and pubis. So that's one thing you need to know. It's a combination of 3 bones. And then another thing is that here is the socket for your femur head to fit into it. And this socket is right here. So we need to know there's a socket here. We later will learn about the name of this socket. That is right here. I hope we talk about it. Do we? Okay. Yes, I think we do. All right. So that's right here. This is called acetabulum. So this socket is for the femur head to fit into it. Yeah. So that's that. So that's the 2 things you need to know. Yeah. So let's look at the pelvis first. So here is a pelvis. So here is a complete pelvic girdle, that complete thing. So get to appreciate their orientation in the body. And so you can see that it has two major pieces. Hip bone. Hip bone is a merge of three bones. And so here we don't really see that border, but you just need to know it has three bones. Right here, you can see that ischium, ilium, ischium, and the pubis. Yeah, so that's the pubis right here. Yeah, so that's three bone. And in the back here, we have the connection of the vertebral column. In the end here, we have the sacrum, and this is coccyx. And so that's that. So that joint is quite clear between the sacrum and ilium, forming the sacroiliac joint. And so with this one basically provide you a cavity. It's called pelvic cavity. And this pelvic cavity basically hosts our bladder, and for female, it also hosts ovaries. Yeah. So that's that. And yeah, so here is the fossa again, iliac fossa. In the edge here is called iliac crest. And then in the front here, we have the arcuate line. Arcuate line determine the upper and the lower portion of the pelvic cavity. Here is another line here, arcuate line, and then here is the pectineal line. This one is the acetabulum. This one allow the femur head to joint, create the hip joint. And then in the front here, we have this part is the pubic tubercle, allow muscle to attach to it. Here is the pubic crest. Two hip bone join in the front is called pubic symphysis. This is a cartilage. And then this hole right here is called obturator foramen. This obturator foramen very much closed. There are a lot of membrane close it. So, but it only allowed obturator nerve to go through, an obturator nerve, yeah, to go through. So not many things go through here, even though this hole is pretty big. It's very much membrane close it up. And here is that, the base of your pelvic. So three bones, ilium, pubis, ischium. Yeah, so that's that. Key thing here is that femur head fits into the acetabulum to form the hip joint. The back, what you can see is all right. Thank you. So I will just stop to edit a little bit. Yeah, just make it more complete. All right, so from the back, uh, you can see here is the ilium, and you can see here is the spine, the sacrum. This is the spinous process in the typical spine, but here it called it median sacral crest right here. And here you can see that sacral foramen. So basically a lot of the nerve will coming from our spinal cord and through this back hole and enter into the back of your side, basically into your side, into your legs. Yeah. So here is this one is called posterior superior iliac spine. This is the posterior inferior. So you have the posterior portion. You have two spines. One is called superior. The other one is called inferior. And this is called iliac spine because this is an iliac bone. And this one is the sacral hiatus and the coccyx. Yeah. And yeah, so here is sacral corneum, and here is another spine, ischian spine, and here is the ischian tuberosity. Allow muscle to attach to it. Yeah. So, I also want to talk about this bone. It allow many muscle to attach to it. One important bone that we will talk about quite often is the quadriceps, femoralis. So here is the femur that uh, we also look into it, and here is how do this muscle attach to the attached to the hip. So you can see that many of these tendons will go further up into the pelvis. What I want to use these slides is to show you some other features. So this one is not one we know already, iliac crest. But here, these two doesn't really mention in our previous slides. That's what I add this one here because these two are kind of important. So here we have the anterior right here. Here we have the anterior because that's the front, iliac spine, anterior superior iliac spine, anterior inferior iliac spine. So that's the front, anterior one. We also have the posterior one, we just saw it here. Posterior superior iliac spine and the posterior inferior iliac spine. So just so you know that we have anterior, we also have posterior. And this one basically allow muscle to attach to it. We will learn more about the muscle in our next lecture. Yeah. So that's the main thing that I want you to know. This muscle, this quadriceps has four. Quadra means four. Four muscle involve one rectus, uh, right here, rectus femoris right here. So you attach to that, and also three vastus muscle, the medial, intermedius, the lateral, and the medialis. So that's the quadriceps. Very strong muscle to control our body. All right. So after the pelvic uh, pelvis, we the next one is the femur, uh, our leg. And here femur has a femur head. Femur head fit into the acetabulum of the hip bone. And then you have the greater trochanter, and down here is the lesser trochanter. This is this is the intertrochantary line. This one is the another line. This is a pectineal line, and this portion basically is a surgical neck of the right here, neck, and this surgical neck here, yeah, neck of the femur. And then going down here, you have the shaft of the femur, and then going down here, you have another smooth area. You see one merged one in the anterior view. They will split into two area. And so when you see the posterior, you see these two um, uh, area that's covered by the cartilage. And in the front, we call it the patellar surface. Patella will sit on it. And in the back, we see this one is a medial, because that's medial condyle, and lateral condyle. And here we have the medial epicondyle and the lateral epicondyle. So I think that's a major thing here. So that's the femur, and then femur will one side join with the hip bone, join the acetabulum to form the hip joint, and the other end will attach to tibia with the patella right here, patella to form the knee joint. And so we will look into that. Here is the patella. Patella sit on the patellar surface of the femur. Here, patellar surface of the femur. So you can see that it will basically create some leverage for uh, quadriceps muscle right here. Quadriceps muscle to control your leg. Yeah. So right here. So this is quadriceps. You have the rectus femoris. You also have the vastus intermedius, and they all merge here. They will went through the patella and anchor on the tibia. So here is the patella bone. You have a base. You have the apex, femur bone, and then medial epicondyle that we mentioned earlier, lateral epicondyle, and some other like smaller structure. But one thing you need to know here is that first of all, patella sit inside of the tendon of the quadriceps muscle, quadriceps femoralis muscle. So which tendon does this patella sit into? It sit into the tendon of the quadriceps femoralis muscle. And which bone does it anchor with, or does it join with? It join with the femur. Yeah, join with the femur. It doesn't touch. It does not articulate with the tibia. So that's a key thing here. Yeah. And so that forms the knee joint, and here is the tibia. We will look more into it, so you can see this is the tibia, the major bone. If you touch it, you can feel it. And on the side of it, in the lateral side of it, you have fibula. Yeah, right here. So here is the tibia. You can feel it, and the lateral side of your leg is the fibula. You don't really feel it. It's embedded it's all covered by the muscle. Uh, so here is the tibia. Tibia is a big bone. Two ends are all very big. So on the proximal end, it forms the knee joint with the femur. On the other end, it forms the ankle joint with the foot. Yeah. So tibia, you have very big tuberosity, tibia tuberosity. So basically, tendon will come here, attached to it. And then this one is the condyle, lateral condyle, medial condyle. And then here is the fibula. This is the head of the fibula. And then between here is the inter uh, osseous membrane of the leg. And yeah, so basically that is the primary thing. This is shaft of the tibia, shaft of the fibula. And then going down here, tibia will also provide the surface area for your ankles. This is the fibula, and here is the lateral malleolus of the fibula. Inferior tibial fibular joint. This is so these two bones join together in two ends. Yeah, so that's that. So here one showing you the quadriceps, the rectus, femoralis, three vestus, vesti, three vesti, each one is vestus, vestus intermedia, vestus media, vestus lateralis. Their tendon will go through the patella and then anchor on the tibia, anchor on the tibial tuberosity. So that's a key thing you need to know. And then in the end, this one will form joint with your foot. Your foot also has three parts. One is called uh, tarsals, uh, and then metatarsals, and then phalange. Yeah. So here you can see that the tarsal right here, tarsals. So tarsal bones, you have this one is called the calcaneus. This one from your heel. And the top here you have the talus. Talus right here. Talus. This is talus. Talus provide you a smooth surface to allow the joint movement with the tibia. So here is the tibia, tibia right here. So tibia and the talus form the ankle joints. So you need to know that what's the bones, what's their connection create or provide the joint movement. So joint movement is primarily provided by tibia and the talus. Yeah. So that's the primary thing you need to know. And our heel is the calcaneus. And then down here, we have these tarsal bones, tarsals. And then going to the foot, we have the metatarsals, and then the fingers, not toes, is the phalanges. So you can see that's that. Yeah. That is everything you need to know about the appendicular bones, appendicular skeleton. And um, let me know if you have any question. All right. Okay, see you next time. Bye bye.